Tēnā koutou katoa, tēnei te mihi ki a koutou, kua hui mai nei a tinana. Ka mihi hoki ki a koutou, kua tae mai a zui. Nau mai haere mai koutou katoa ki tēnei kōrero, tēnei Whānau Ora semana. Tuatahi, ka mihi ki a koutou, ki ngā mana whenua, Ngāti Whānau-ā-Kai. Ka mihi hoki ki te kaupapa e hapai ake I tō kaumātua pauora o tira ko Waiau, e uri ahau no kaitahu me ko tirana, ko Karen Wright tōku ingoa, e mahi ana au kei te kapinga hauora Māori. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. It's my pleasure to welcome you all, those here in person and those online, to this August Whānau Ora seminar. Before we get into the very exciting part of the session, which is clearly our speakers, just a couple of housekeeping notices. First of all, you'll see that this session is being recorded. This is for the presentation only, and that's so we can share that with others who are unable to be here today. We will have the opportunity for questions afterwards, so please feel free to think of those as you hear the presentation, and we look forward to that engagement. For those of us that are here in person, we'll be able to have share a cup of tea and a biscuit afterwards for a bit of whakawhanaungatanga. For those that are online, you're welcome to do that whakawhanaungatanga in the chat, which I can see has already started. Yes, so as I said, my name's Karen. I'm filling in for Annika, who can't be here in person today. And it's my absolute pleasure to be introducing a wonderful session today. Which is Whaioranga, te paeārahi-led, iwi-driven injury prevention and recovery for older Māori. I will leave the speakers to talk to this further, but it's an absolute pleasure to have two wonderful speakers, one here in person and one joining us from the Zoom room. So we have Dr. Joanna Hikaka and Louise Ihimaera. Now, both wear many hats, and I'll let them talk to their introductions and those many hats themselves. But just as a start, Dr. Joanna Hikaka is a pharmacist and a senior research fellow here at Waipapa Taumata, Te Kapinga Hauora Māori. Is also co-director of the newly established Centre for Co-Created Ageing Research. So her research and clinical areas focus on older adult and Māori health. In the Zoom room, it's a pleasure to have Louise Ihimaera joining us. Kia ora, Louise. Louise is a project manager and kaupapa Māori researcher and brings with her clinical and cultural research experience and hauora development experience in Māori health and mental health. And pleasure to have Louise, who's a co-investigator on the project and the research that's being presented today. So I'll get you to join me in welcoming Joe up to the lectern here in person and Louisa in the Zoom room.
Tēnā koutou katoa, ngā mihi mahana ki a koutou, ko Taranaki te maunga, ko Ngāruahine te iwi, ko te mahuru o te hapu, ko Joe Hikaka tōku ingoa. I, as introduced, am a pharmacist, and I think we're just sorting some tech out here, pharmacist and health services researcher based in Taumata at Waipapa Taumata in Te Kuminga Hauora Māori. And it's my pleasure to be here today to co-present this, some of the work that we've been doing over the last 2.5 years, 3 years together. So without further ado, I will pass on to Whaea Louise so that she can introduce herself. Kia ora, Whaea.
Kia ora koutou katoa, kia ora Joe. Ngā mihi mahana kia koutou tēnei wā. He tino mahana ki rohe o te mata Māui, kei te whiti te rā. Kua hau he uri o ngā iwi maha, he uri o Whānau-ā-Kai ki Waituhi, he uri o Ngāti Whare, me Ngāti Manawa, me whakatohia ki Ngāti Kahungunu hoki, i te tā tōku pāpa. I te tā tōku mama, he Ngāti Porou, ia, he tino tūturu, ia i tēnei iwi. Kia ora, I'm Louise. I guess in some ways I think that I am Joe's sidekick. I came into the project not as long as Joe, but I joined when she came in and introduced herself before COVID. I was part of the team that was just looking on and in. And because some people were not available at the time, we needed to get some things done. I was offered the opportunity to join Whaioranga Te Pāharakeke. And it's been a great journey. So without any further ado, I'll pass the time back to Joe. Yeah, me tīmata. Awa.
Kia ora whaea. So we'll see how this dual presentation goes. We're quite used to presenting together, but we're usually both online. And so this is a bit of a change from our normal habits, and we'll see how we go. And I'll keep looking to you, Whaea, to check that I haven't gone past something you want to have a kōrero about. So we're going to introduce this project today. We've introduced ourselves and we'll give you a bit of background about this project. 3 years ago, ACC and HRC put out an RFP asking for sort of research proposals that might address and increase knowledge around access for older Māori to ACC and potentially some solutions to improve access. So at the time, ACC were quite aware that there were inequities in access for Māori to ACC services, higher rates of injury for Māori compared to non-Māori. But in terms of older Māori, any variation in access to outcomes, there wasn't a lot of information, and equally there weren't sort of some robust solutions to how, to improve access equity for Māori to ACC services, but also injury prevention, rehabilitation, and care more broadly. So they put out a funding call, and I guess just to give you a bit of background, you probably are aware that ACC sort of covers injury-related care in Aotearoa. It also is highly invested in injury prevention, because if they can prevent injuries, they can reduce the costs of care, and they're also involved in recovery and rehabilitation. And I just thought it's worth bearing in mind that although there's lots of issues with ACC in terms of equity, we are kind of unique in the world in terms of our injury care. And that's certainly something that I've experienced when I've gone overseas and can compare it to what we have access to here. Something else I just wanted to emphasize in their logo, and we'll probably touch on it later, is the fact that there's prevention, full stop, care, full stop, recovery, full stop, and it's quite sort of a siloed approach to all those three things, despite the fact that there's a continuum of injury related need along those. In terms of ACC, there's different departments that work in those three spaces, and a fourth department working in Māori health space. So there's the different departments within ACC. So people from Waipapa Taumata and Te Arawa Whānau Ora collective got together and put in an RFP. So right from the application stage, we were working together, and that relationship sort of came about because of lots of individual relationships that already existed. But it was the first time that the two organisations had formally worked together in partnership on research. And as part of our RFP, we looked to the role of paeārahi or Whānau, there's a spelling mistake, Whānau Ora navigators, and what paeārahi could provide in that space, in the injury prevention and care space. So paeārahi were not unknown in Te Arawa Whānau Ora collective. They'd been that those roles had been used to support health and wellbeing for Māori and non-Māori in Te Arawa for over a decade. But in terms of injury prevention and injury specialisation, that was something new. Whaea Louise, do you want to add anything there around the role of paeārahi within Te Arawa?
Only that even though they sit under an unregulated workforce, many of them have qualifications, probably mainly within the support field, but and very strong in terms of their cultural qualifications. Some have degrees in Te Reo. So it just, yeah, it might give off the idea that they're actually not qualified, though they're unregulated, but they are very qualified individuals, and as part of their hapu iwi responsibility, Te Arawa is really strong on ensuring that anyone who takes that kind of role of being a paeārahi actually come from one of their hapu or their iwi or their marae. And that is quite unique in some ways within Te Arawa that I have found as I've worked in different areas. But it's strictly if you belong to the area, you will qualify for that role. If you don't, they'll find something else for you to do. Kia ora.
Ora. And so the overall aim of the research project was to test the feasibility and acceptability of a paeārahi-led intervention on injury prevention, treatment and rehabilitation, and to also assess ACC access for older Māori in the Te Arawa. So just touching on whaioranga te pāharekeke, we sort of acknowledged as a research team that we were coming together and bringing a lot of diverse knowledge, skills and experiences into that space, but that we were also working together for a collective good, and that sort of how Waipapa, Merito, who's one of the co-investigators, sort of gifted that name for the project and what the endeavours we were undertaking. And then another talented spouse of a co-investigator created this image for us to represent that working together for whaioranga. So the research project is a multi-phase project. Phase 1 was all about establishing baseline evidence. So although ACC suspected there was inequity of access to ACC services and injury care, there wasn't good evidence to show that. Phase 2 was looking at co-designing, co-developing paeārahi intervention to address injury care. And so this was, and Whaea Louise is going to talk in depth about this phase. So it was thinking about understanding people's experiences and expectations of care, injury-related care, and also their solutions, their ideas for how care could be improved. Once we had this intervention, we were going to test it in a feasibility and acceptability study, and then use that information to synthesize recommendations and disseminate that knowledge. So when we were looking in phase 1, it was all about understanding what was happening already in the injury prevention space, as well as Māori-focused research in that space. And when we think about older adults in the general population, falls tend to be a big type of injury. So we were looking at unintentional injury. Sorry, I didn't specify that earlier. So unintentional injury means that injuries such as assault, self-harm, those things would be excluded. And so when we think about unintentional injury in the older adult population, falls is often the most common type of injury. So when we looked at national and international literature, including research that focused on Māori, we could see that there were multiple different aspects that were important and that had evidence for improving injury prevention or outcomes after injury. So it was looking at the home environment, strength and balance exercises, ensuring there's social connectedness. There were things around the safe communities, so moving outside the home environment, the importance of smoke alarms, things like gardening, supporting injury prevention. And we also looked at Ministry of Health and ACC data to describe the incidents and characteristics of unintentional injury in older Māori. And so from this from this work, and we're still on the way of publishing this, but we found that for older Māori in the Te Arawa, so we looked at Lakes DHB and Bay of Plenty DHBs at those times. So again, acknowledging that that's not necessarily Te Arawa, but Te Arawa spans both of those DHBs. So there were people, I guess, captured in that data that wouldn't have been from that rohe. And so we did look at actually looking at that data from the Te Arawa specific sort of geocodes and things, and I'm like nervous because Donna's in the room and will know way more about this kind of stuff than me. But it requires someone to go through by hand and have a really intimate knowledge of the geographical location, going through every like thousands of like geographical codes to try and pull out just Te Arawa here. And I do know that there's work going on sort of at a different level to try and improve the fidelity, I guess, of that information. So we found for older Māori in Lakes and Bay of Plenty DHBs, injuries were most commonly occurring at home, they were occurring as a result of falls, and they were occurring and soft tissue injuries were the type of injuries that were occurring most commonly. And I think it was interesting for us that just to look at that falls data, because older Māori are less likely to fall than non-Māori, and so sometimes there's a focus on non-Māori in terms of falls prevention, but it was still the most common type of injury for older Māori. And then Whaea, over to you for what we did next.
Okay, so we, I became more involved in phase 2 in terms of getting the koike and whānau aspirations and solutions to what could be done better for those who live in Te Arawa. So you'll see from our beginning, we've got our koike, some of our koike who participated in the Olympics that was held over in Te Arawa, and also we have our paeārahi that have come present there as well to tautoko them. So our theme has been from Te Arawa is from whakamā to whakamana, mauiwitanga to Māori ora. So those things came really clear. Thank you, Joe. Those things became very clear in terms of what injury prevention and recovery means to our older Māori. So what you're seeing here is we've taken a creative approach in how we are presenting our journey in terms of whaioranga te pāharakeke. Partly we did this for our sustainability proposal that is still on the table with ACC, but we're expecting that to be confirmed shortly within the next few days anyway. Thanks, Joe. So the three main providers there are Te Runanga o Ngāti Pikiao, one of the smaller providers, but have really strong in terms of the whakapapa links and also the land that is owned around that area. All of the three, we've got Korowai Aroha Health Centre, so both of them are in Te Arawa are mandated by the iwi and Hapu, and then Pautiri Wellness Centre, which is in Te Puke, Tapuika and Waitaha, and again they are a mandated iwi provider. And so these are the three providers that have come together and been working quite closely with Waipapa Taumata over the last 2.5 years. So phase 2 focused on the why for Whaioranga Te Pāharakeke program. And the why was to come from in terms of what the koike and whānau believed needed to happen to improve care, recovery and prevention from falls and injury for themselves. It also informed what the paeārahi-led intervention would look like and what they would do. And therefore, from the kōrero that was shared by all those who participated, we had over or just under 50 participants. We had paeārahi, koike and allied health participate as groups in Ropu, and we also had some individual koike interviews, as well as Māori health managers, basically anyone who was interested were welcomed on board to be interviewed. But this supported and informed the development and implementation of whaeoranga he hikoitanga mo te koike ora training program. And just so that you know how seriously we take this, we worked with Waipapa Taumata in terms of getting the program ready for micro-credentialing. And last year, this program was micro-credentialed through Te Rau Ora, who is NZQA accredited, to level 5. So we're really excited that the program that the koike themselves had said what they needed to learn about, what they needed to have our paeārahi help them with, plus all the other clinical learnings we did and needed to do, have been able to find some fruits in terms of it being a micro-credentialed module for any NZQA program. Kia ora. So our next one, this is about their experiences of injury. So the key themes that were coming through, and you can see that picture actually, it was a bit with tongue in cheek. So this is the 3, steps to life training that the koike had been, were part of, but they actually had their own steps that they felt that ACC needed to provide and to improve on. And it wasn't just ACC, there was also some barriers that we experienced in terms of what was happening with some of our rehabilitative services out in the community when our people weren't able to get appointments to physiotherapy, a really basic need, where some of them going once did not return. So these things were really big for our people in the terms of poor communication, the long-lasting negative effects on their hinengaro, wairua and their mana motuhake. So when we talk about hinengaro and what impact that was, we're talking about trauma and how big that was for many of our koike that had been through the ACC process or tried to get through to the ACC process. Some of them still had been living with not even having made it to first base. And so this is where it had been really helpful in terms of how the Waipapa Taumata and the senior management team could look at how we're going to help koike in terms of what they thought the improvements could be. So, some of them just gave up, as it was often too hard to reach an acceptable outcome, but in the end, they felt that with good injury care, that their independence and autonomy could be enhanced. But the impact certainly on the wairua, mana motuhake and hinengaro was the biggest impact we saw for our koike. Some of them that were still carrying the effects of an injury that had not been seen to as well as it should have been. For them, that was, well, that's just how it is. That's my life, but I still want to get on. I still want to go to the marae. I still want to support what's happening, and I want something done about my medication that stops me from doing these sorts of things. So, yes, that was some of their experiences with ACC and other rehabilitative services in their communities. So koike and whānau identified the must-haves. So you can see the must-haves there, that we've put a collage there together. Actually, they were keen that the holistic approach would centre on Māori values and whānau, because that's essential to injury-related care. We could not separate koike from their whānau, and neither can you separate whānau from the koike. Many of them continue to be carers for their mokopuna or their mokopuna tuarua hoki, because of how life is for many of the families. Te Poke having one of the lowest socioeconomic ratings for the Bay of Plenty. So they wanted us to help the paeārahi to get out and learn about what's out there in the community. They wanted a more collaborative approach with community and rehabilitation services, and they had a real fear about how we were going to do that. And what was really great with getting a training program together, when we got ready for it, we brought the community into that training program. We had a day where they could come and meet the paeārahi and tell them what they do and give us a person that we could be able to have a contact with. Also from that having them come, we were able to also create a community advisory group that has been with us for the last 18 months through phases 2 and 3. They have come from Te Arawa. So we've got a physiotherapist, we have a GP, also we have a kaiako from one of the training institutions. She was interested in our program as well. We have koe care representation. So, and all Māori, all from Te Arawa. They also wanted, as you can see, increase social activities, and there they all went together to watch the movie Muru. Some of them hadn't been to a movie for a long time, but going together was important for them, and whanaungatanga for koe care was important, and they saw how paeārahi can play a part in this. Kia Joe.
Okay, come in.
Okay, so these are the things that they said must happen in terms of improvement in injury prevention and care. Māori for, Māori by, Māori services. So they were insisting that we needed to have more Māori. So what did that mean for us in the project? So we actually had to go and track down Māori physiotherapists. There were 2 or 3 working in the Te Arawa area. Some of them were hard to get hold of us because they were terribly busy and working for mainstream services at the time. One particularly seemed to, was a strong, I believe, strong Wairua thing that I needed to contact this one. So you're going to meet him soon when you see him come up. He was quite a reluctant person to pick up and answer a phone or to receive a phone message. So this next time when he would be arriving and maybe getting ready to go to his first client, and I wasn't stalking him, I was just being clever and strategic about how I was going to get this Māori male physiotherapist onto our advisory group. And I rang and it worked, that strategy worked, he happened to be there. I just said to the admin person, tell him his auntie wants to talk to him. So he got on the phone and said, hello auntie, and then I introduced myself, said, kia ora te oke, ko Louise Ihimaera tēnei. And then we both had a laugh. And then after that, he joined our program, joined our advisory group. It was only like 3 or 4 months into the group that he started to realize something that he wanted. And so we were able to help him. We got extra funding from the DHB at the time for a Māori physiotherapist for our koe care programs that we're running across in Tautiri and Te Arawa. And he was able to set up clinics for 1 day a week in each area for our people. Yeah, so that was a really important part of looking to have more Māori services available. We now have a Māori podiatrist who is available also, who goes across the 3 medical centres for our people. It was noticeable, you've got nannies, you've got papas. I don't know how many of them you see wearing gumboots a lot, but these ones who wore gumboots, it wasn't just about being in the rural area, it was because their feet needed so much treatment and were swollen that they couldn't actually wear their shoes. So, so this has been really cool what happened for them. So access to services and equipment that could reduce these types of risks to their tinana, their waiwai. There the advocacy for access to ACC and the entitlements to the resources and care services that they could have, including specialist care particularly. The advocates therefore needed to have insight into ACC processes and able to support navigation through rehabilitation services. So we brought on board an ACC frontline worker into our advisory group, and also one of the national project leaders, Māori. She also came on board in our advisory group, and that has made such a big difference to how we've been able to make some traction in terms of this project. Thank you, Joe. There he is, there's Te Oke Prior. I don't know if you know him or his whānau. He is tūhoi as well as Te Arawa length, but he is truly making a difference for our people. Sitting there in the marae, this is Makahai Marae. I think that he's speaking it. No, that's not Makahai Marae. This one is on the lakeside. And that is two of the wahine sitting there are two of our paeārahi that work within that area. One is Ngāti Porou, the other one is Ngāti Whare and Ngāti Manawa, and they're working across those areas. Kia ora. Okay, so these are our people who have been supporting us and what we've been doing. We've got Kirsty Maxwell Crawford, Hare Meditor, and Hariata Veko. So tomorrow, as a team, we're meeting with Osteoporosis New Zealand. They are keen to look at what we've done with Whaoranga Te Pāharakeke in terms of how they can also fill some of the gaps for that are missing with fracture liaison services. And we acknowledge our Waipapa Taumata team. I don't know if now's the time to talk about it, Joe, but this partnership has made a difference in terms of how ACC now looks at us. Where you saw prevention.care.recovery. Well, we've been able to take those dots away. Right now, we are negotiating, have been part of the negotiations with ACC. They're looking at a partnership with Te Arawa Whānau Ora that goes across their 5 teams within ACC who deal with injury prevention and care. Kia ora, kia mihi.
And I guess that's sort of key. So Whaea Louise was bringing up all the different sort of service funding that we've been seeking through this project, and that was always our intention, that we're trying to work towards a sustainable service model that has benefit for Koiki and Te Arawa. And so I wanted to preface the fact that we're moving into phase 3 and talking about a whole lot of assessments with that kind of in mind. We tried really hard to try and get that balance right between, you know, not having this high assessment burden, but also having good evidence to show the impact of the intervention. So what was the paeārahi intervention going to look like? We had different components in it. So paeārahi would visit Koiki in their home or work, because some people were still working and that was most convenient for them. There'd be weekly phone calls. There'd be a Whānau Ora assessment, which was already a sort of a holistic assessment that was occurring through Te Arawa providers. There'd be a home assessment, so looking at hazards within the home, and Whaea Louise and Kirsty sort of did ACC's assessment to make it appropriate in those spaces. There was a mini health assessment, so something that came through quite strongly in phase 2 was that link between you know, health conditions and injury and health conditions, and the backwards and forwards. So we wanted to just do you know, when I say mini health assessment, it was questions like, have you lost weight recently? Like, do your clothes fit more loosely? Do you have trouble seeing things, trouble with your vision? Do your shoes fit well? So things like that. And then there were sort of referral pathways dependent on the answer. there was going to be sort of an exercise program, and initially we thought paeārahi would be referring into group programs, but really when we talked to people in phase 2, there were no programs that Koiki and Te Arawa felt were culturally safe. So part of the intervention ended up being with the paeārahi and people like Te Oke supporting to develop a group exercise program. And then education, and that was more around sort of probably education advocacy of people's rights to access injury care and how to do that. Our primary outcome was this as a service, this is intervention acceptable to koike, to paeārahi, to whānau, to other providers. And then we looked at another, a whole realm of other sort of outcomes. We have done this through we're doing it through both secondary care data, so routinely collected data like hospitalizations, ED presentations, ACC claims, some primary care records, as well as some assessment tools. And we're also doing process evaluation, so understanding the implementation and what changed with the intervention as time went on and when you learnt more. So we had an iwi-led strength and balance program. This is a picture with Te Oke at the back again in the marae. And so this is sort of some of the koiki that are getting together, learning. You can see the poi there, so they're about to do some activities with poi, which helps with coordination. Teaming up exercise that require a cognitive component as well as a physical component are really important for that strength and balance and falls risk reduction. Okay, another pic of that. The other thing we tried to do, and Whaea Louise has touched on this, but really ensure that decision makers were going along on this journey with us. So we got together a group of stakeholders from HRC, ACC, Ageing Well, because they're the 3 bodies funding this research, as well as people at Health Quality Safety Commission. We tried to engage with different people through ministry, sort of at the time of the health reforms, and not really sure who were the people to be engaged, but locally in terms of Te Whatu Ora, Lakes and Bay of Plenty, and yeah, so we would meet with them every 6 to 8 weeks and just give them an update about what's happening. And sort of for us, it's a way of ensuring some accountability. So we always say, and we've only got 6 months left on the project, so what's happening with funding? We've only got 3 months left on the project. Who do we need to be talking to have these conversations, move them forward? But also it's sort of just like a little infographic that they can share with others as well to sort of increase the visibility of the project. And so, yeah, we were wanting to create impact, obviously, and positive outcomes in Te Arawa. So some of the steps we've talked about is trying to ensure that sustainable service delivery. We're thinking through the utility of the sort of specialist paeārahi role, and we've seen, evidence for that in other things like diabetes and child health and wellbeing. And now we're hoping to show that in the injury space as well. Workforce development was really important. So not just in terms of clinical practice and paeārahi roles, but also in the research space, trying to support local research capacity and capability. And ongoing relationships. So for me, this was sort of a new relationship with Te Arawa. I don't live in Te Arawa, I don't whakapapa to Te Arawa, so recognising my place and where that was or wasn't within the research, I think it's been important. And so although this research, we're in the evaluation stage at the moment, so we've finished the intervention and implementation sort of phase of it. We still are involved in other ongoing projects that are and aren't related to Waioranga. And then, yeah, I guess just some other research that's coming out at the same time. So we've also found that there's an inequities in treatment, injury and complications of healthcare, and so what we can do in that space. So treatment injuries and complications of healthcare are often excluded when you look at unintentional injury, because it's sort of different drivers and mechanisms that they use to intervene at different levels in the health system. But yeah, so there's the potential for advocacy in that space too. So I think we've all sort of talked about the benefits of partnership, and we actively reflect on this, don't we, Whaea? And I think though that it was a bit naive. I was thinking, okay, we've got a good relationship to start with, but managing and understanding what partnership looks like is something we probably need to think of, if not daily, weekly, Whaea, and like, oh, I don't know, what do we think? Do we take it back? And so negotiating those, and different things have changed as we've gone along, and there's more trust in the relationship. So I think for us, that's been a reflection, is that I guess with any relationship, you're always wanting to ensure it's well maintained and enhanced, so we try to do that through our time working together as well. And just to acknowledge, we wrote this application, like we started in August 2020, I think about 4 days before we went into a month lockdown in Auckland. And then we got the funding was confirmed in March, and we started the interviews for phase 2 in August 2021. And yeah, so this was sort of lots of our meetings, us in Auckland in our separate homes, but Te Arawa whānau could still get together. And then as we went to roll out the intervention, sort of the Delta Omicron sort of was starting to kick off in that area, and so things were delayed. So yeah, and then I guess Whaea Louise brought us all together in January of this year, and it was just a real reflection of how we missed being in that physical space together. And we did what we could, but I think also the importance in terms of this research progressing is that Te Arawa researchers and providers really believed in the need for this research, which meant even though COVID was occurring, we could still progress through everything, and they were really really driven to ensure that the research was continuing alongside the setting up the vaccination, setting up the swabbing, setting up the isolation facilities. So Waipapa was setting up a community isolation facility, and we ended up then returning in February of this year there, and it was a wānanga space for us as a rōpū. So it was there's been some cool journeys through this research together as well. So I just wanted to formally acknowledge all the research participants that have contributed to this, to all our research team members and our funders. And I'm just going to pass back to you, Whaea, for any last words, reflections, or we can just move to questions.
Yes, we can move to questions, but thank you, Jo.
Okay.
Yeah, that's great.
Tēnā kōrua. Let's just thank Jo and Louise for that wonderful presentation.